I'm joined by Dr. Shilpa Rajashekar of ProHealth Physicians. Thanks for being with us. Now, this is a real concern because most people don't think younger people, adolescents, are at risk for cardiac arrest, but as we're seeing now, there is a real concern.
Thank you. Thank you for having me here in this stage and talk about heart disease in children and young adults. As you know that there's about 7,000 cardiac arrest cases out of the hospital, so it's really a concern. Like when you think about heart disease, you usually think about adults, and you don't really understand that there are young kids and children that suffer from cardiac arrest.
Right, initially you don't think young people are as much at risk, but that's not the case.
Yeah, so like I said, there's reported about 7,000 young children that have out of hospital cardiac arrest cases that have been reported. So, this is kind of very dear to me. My grandmother had a cardiac arrest at the age of 58. So, and I have a personal story to share. In our office, which is on 599 Farmington Avenue. So a mom brought a child who was unconscious and wasn't breathing or completely limp, and she rushed the baby into the medical facility. She was driving on the highway. She rushed the baby into the medical facility that she could find. She brought the baby into our building. So our staff and us, we're all trained with the CPR. So what I want to tell here is using the general CPR techniques, we can save life. So this child, we initiated the call for help. We called 911. We assessed the child. We opened the airway, let the child on the back, kind of gave the initial compressions, and gave the breaths, and the baby was able to be revived. So it's very important to understand that CPR is an important step, and it's always good to do that immediately when available. And also, you have children that are in the sports, when they have like sports-related cardiac, arrest.
Right,
so
on
you
the
need,
field or something
on
like
the
that.
field or something like that. You can initiate like an AED and call for help and start with the CPR right away.
I mean, that's every parent's nightmare. What would you say to parents that's most important to remember as far as steps on what they should do first?
So call for help first, and initiate that 911 call so the EMS arrives with all the support, and expose the child, look and assess, assess the children whether they're responsive or unresponsive. So open the airway, follow the ABC guidelines, open the airway, lay the baby on the back. If it's on the side, listen for breath sounds, feel for the pulse. So if it's an infant, usually you're feeling for the brachial pulse, and if it's a younger child, you're feeling for the carotid pulse. So you do this assessment in the first 10 seconds, and if you don't feel a pulse and you don't hear the breath sounds, you go with the compression. And a very good compression is what I would say is important. So you're looking for a compression where you're seeing the chest recoil, and 30 compressions to 2 breaths is what I would say if it's a one person.
So 30 and 2, and of course, one of the most important and probably the most difficult is to stay calm among all, amidst all of this. Doctor, thank you so much for being with us. It's a really important reminder for everybody to keep that in mind under those super stressful, scary situations.
Thank you. Thank you for having me here, and happy Valentine's Day, and take care of your heart, and also take care of your loved one's heart. Thank you.
Right. Valentine's Day isn't just about cards and chocolates. It's about making sure that you are heart healthy and knowing what you need to do if you know somebody who is not and has an emergency. Doctor, thanks so much for being with us.
Thank you.